The landscape of Rhode Island is unmistakable, marked by beauty, rich in history, and home to many caring faces of friends, neighbors, and family. Kent Hospital has been part of this landscape and your family for more than 58 years. Since the days the doors first opened, we have been here, right in your backyard. We have been there through many of your life's milestones, and together helped you meet the challenges that strengthen you and those you love.
Kent was founded by a group of physicians who wanted to bring healthcare to this local community. And I think that theme of connection to community and service to the community has been constant throughout our history.
Good people have been an integral part of the Kent experience since we first opened our doors to the public in 1951.
Medical care is changing. Many people rely on an emergency room for their health care. Kent Hospital has to change and is changing to adapt to whatever your health care needs are. If your doctor's offices are closed, or if you don't have a doctor, you can always come here. If there's an emergency in the community, we have to fulfill the health care needs for that emergency.
Kent is a community hospital working to meet your needs from the minor to the complex. We provide an array of services that is never more than a few minutes away, with accessibility and high-quality care. Our services make it easy for you to live your life while managing your health. Convenient appointments focus on your schedule, whether it is after hours or on the weekends. Our nationally accredited stroke program and rehabilitation center help get you back on your feet, while other life-saving treatments are all part of the critical care provided here.
I see this hospital supplying nearly every health need this community has. I see the community growing, and I see the character of healthcare growing. This is not just going to be hospital-based care that we're giving. We're going to open an ambulatory center that will provide increasing amount of outpatient care. Your surgery in the outpatient arena will be done here. Many services will be there, that your doctor's offices will be there.
Our focus on your care also means that the future of Kent Hospital is bright. New facilities for outpatient surgery are being developed. Our women's health program is positioned to provide an even higher level of comprehensive care, while our new cardiac catheterization lab is serving our community.
Medicine is changing every day, and we will continue to focus on providing services that are developing and required for the patients in our community.
Kent Hospital is also helping to shape the next generation of doctors who will care for you. As a teaching hospital with programs in family and emergency medicine, we have attracted some of the finest individuals from across the nation and beyond.
Once I saw what their vision was for the program and how they saw the residency program going and what they thought it was going to become over the next 2, 3, 4 years, I realized that it was something that I wanted to be involved in.
I feel as if I'm not one of 100 residents. I'm a unique individual, and people here know me personally, and they really treat me as one of the community.
I feel like the program overall reaches out to the community more. We're actually able to see more patients right now, and our volume's gone up in the emergency department over the past year, year and a half.
Kent has given me so much throughout my entire life and in my medical education. So being able to be here and work here really gives me an opportunity to give back to the community and to the hospital. So it's a really unique and great experience.
Over time, our community may change. We may make new neighbors and say goodbye to old friends. Over the years, our families have grown, moved down the road, or perhaps a bit farther away. Despite these changes that are all part of life, your need for high-quality, compassionate care remains a constant.
My daughter was going in for a simple procedure. All of a sudden there was this curtain between myself and my daughter, and I was being escorted to the waiting area in the ICU. You know, something looked drastically wrong. And lo and behold, my life went upside down. When we knew that she was going to survive, it was like the greatest moment of my life. She was dying. She could have been dead. And 2 days later, she's laughing. And this, I know, this is a miracle. And the miracle workers are those who are the workers of the hospital, you know. And I am eternally grateful to Kent Hospital. You know, they saved my daughter's life.
Kent is a special place purely by the people that are working here and that have committed themselves to it. It's more than just the four walls and pieces of equipment, whether they be new or old. It's really a family and everybody feeling that they're a part of something good.
One of our values is to serve our community, and as I look forward, we will do that more and more. And one of the things that makes me so proud is the level of activity and engagement and volunteerism of the Kent staff.
There's always something about Kent to tell others about. The emergency room, the sleep lab, the recognition as a primary stroke center, the improvements in our cardiology program, the graduate medical education.
You can get really fantastic care here, and you don't need to go to a huge tertiary care facility to get quality care. You can get it right here in your own backyard, and I think that's great.
In spite of its growth, both in terms of the type of services it offers, as well as its physical size, it remains a community hospital.
Kent Hospital has grown with you through the years, in its size, in the scope of services provided, in the skills and expertise of our staff. Just as in the past, you can always count on Kent to be here for you, now and in the future, with a warm smile, a dedication to make you well, and a commitment to care for family, friends, and loved ones. This is an uncompromising commitment to our community that is uniquely Kent Hospital.
We are here for you. We are here to take care of our patients, our community, and we will continue to do what we need to do to grow, advance, and become stronger so we can continue that unwavering commitment.